Hello, my name is Brandon, and today we're going to talk about ABG interpretation. Now, I'm really going to break this down into the absolute basics and fundamentals you need, and this is really going to be geared towards nursing students and people who are preparing to take the NCLEX. So we're going to take out a lot of the fluff, and we're going to leave only what's required to answer the questions that might show up on these exams. So we have to talk first, what is an ABG? An ABG is an arterial blood gas. That's an arterial blood sample that's taken to really show us the patient's respiratory status. And it can give us some valuable information as well about what might be going on with this patient clinically. So there's a lot of different values that are on an ABG when the paper gets printed out, but I really want to break it into the three most important numbers for the exam. And that's going to be the pH, which is the acidity or alkalinity of the blood, the PaCO2, the carbon dioxide, which is the level of carbon dioxide that's in the blood as it gets filtered in and out by the lungs, and bicarb, HCO3, which is a substance that the kidneys excrete in order to really regulate the acidity or the alkalinity of your blood. Everything else, for the purpose of the exam, isn't really important. So I do want to go over pH real quick. As you probably remember from your chemistry class, your biology classes, pH is a measure of how acidic something is. The only thing I really want you to remember is that anything below 7 is acidic and everything above 7 is basic. So battery acid, for example, is 0. It's about as acidic as you get. And drain cleaner, complete opposite, all the way towards the basic side. Water has a pH of 7 because it is neither acidic nor basic. So what is the acidity of blood? So there's going to be some magic numbers I want you to remember today, which is 35 to 45. So for our purposes here, 35 to 45 gets applied to the pH, 7.35 to 7.45. That is the normal acidity of blood. Anything below 7.35 we consider acidic. Anything above 7.45 we consider alkaline. So we're going to look at CO2 next. Remember I was talking about those magic numbers, 35 to 45. In this case, the normal values on an ABG for CO2 are 35 to 45. Now, lastly, bicarb unfortunately doesn't fit in our magic number model here, but it's important to know as well, 22 to 26. Now, your nursing school may or may not give you the standard values, but it is important to kind of just remember these. 7.35 to 45, 35, 45, and 22 to 26. So, what do the numbers mean? Well, there's four states, or four situations that the patient could be in that you need to know for the exam. And I've broken it down first into acidotic and alkalotic. Acidosis, alkalosis. Are they acidic? Are they alkaline? And then you could further break that down. Is it from a respiratory cause or a metabolic cause? So your four states you could be in are respiratory acidosis, respiratory alkalosis, or if it's from a metabolic cause, metabolic acidosis and metabolic alkalosis. So we're going back. This slide's going to be very important for the rest of the lesson. CO2, like we talked about CO2 getting exchanged by the lungs, I want you to associate that with respiratory causes. On the other end, bicarb, I want you to associate with metabolic causes. And pH, acidity versus basicity. So this is the way a question might show up in your class or on the NCLEX. A patient's ABG read shows the following: pH 7.22, PaCO2 of 57, and bicarb of 27. How would you describe this patient's condition? And they'll obviously give you all four choices: respiratory or metabolic, acidosis, or alkalosis. So we're going to go back to my favorite slide, and I put the question on the bottom there with the values. pH 7.22, CO2 57, bicarb 24. So what you're going to do, you can write out our little chart up here, 35s and 45s, 22 to 26, and I want you to literally put an arrow that shows is this above or below the standard value. So this person, right, with the pH of 7.22 is below. What does that mean? It means that they're acidic. So let's take it a step further. Their CO2 is 57, which means it's above the normal range. Okay, so we know it's acidotic, and we know that their CO2 is a little bit out of whack. Their bicarb also happens to be a little bit up, but I want you to think of it this way. Always look at the pH first and figure out if they're acidic or they're basic. Then I want you to look at the CO2. Is their CO2 opposite or going the same direction as that pH arrow? If the pH arrow is pointing down and the CO2 arrow is pointing up, if they are going opposite directions, forget about the bicarb. This is of a respiratory cause. So we're going to go back. The bicarb is there, but we're not even looking at the bicarb. If the arrow is down and the other arrow is up, it is of a respiratory cause, and the bicarb does not matter. So we know this patient is acidic, right? And we know that the carbon dioxide is up. It's the opposite arrow. This patient is in respiratory acidosis. So here's a second question. A patient's ABG read shows the following: pH 7.62, CO2 of 21, and bicarb of 24, and then the rest of the question is the same. We're going to go back to my favorite chart. So what is the pH? The pH is 7.62, so is that acidotic or alkalotic? And this patient is alkaline, right, because it's above 7.45. And then PaCO2 of 21, which means that arrow is going down. Again, the pH and the CO2 have opposite facing arrows. So what does that mean? Forget the bicarb. This patient is respiratory alkalosis, right? Because they're alkaline and it's of respiratory cause. We know this because the arrows are opposite. And the bicarb we don't really care about, but then it's within normal range. Opposite arrows equals respiratory. So now let's go the other way. A patient's ABG read shows the following: pH of 6.90, a CO2 of 20, and a bicarb of 14. Anyone who's worked in the ED or the ICU knows exactly what this means. But we know this patient is highly acidic. And where's the CO2? The CO2, the arrow's facing the same way, which means that we move on to the next step. We look at the bicarb. The bicarb is also down at 14. 14 is below 26. So now the pH and the bicarb arrows are facing the same way, which means metabolic acidosis. So like before, instead of the CO2, we're actually going to be looking at the pH and the bicarb. If they are going the same direction, that means this is of metabolic cause. I'm going to repeat that. If you look at the pH and you look at the CO2 and they are not opposite directions, you move on to the bicarb and you know that this is metabolic if they are facing the same direction, the pH and the bicarb. Now I am going to point out this is a quick and dirty way of reading an ABG. It is not by any means in depth, but for the purposes of the NCLEX, this is a good and quick way to do it. I'm going to do a video later on how to really delve into the numbers and figure out what does it mean if the pH is up and the bicarb is down, how's the patient compensating. But until then, this is a good way to get your first look into ABGs, and it's a good way to kind of understand, especially if you're really looking for the fundamentals. So I want to go over real quick some reasons for these conditions, right? So if someone is in respiratory acidosis, what does that mean? So very likely they're in some kind of, I know it's a nursing diagnosis, a little bit older, but they're having some kind of impaired gas exchange. So respiratory acidosis tends to be some kind of asthma exacerbation, COPD exacerbation, or lately it's been something like severe COVID. When someone has a severe respiratory acidosis, very often they end up needing to be intubated, or at the very least the cause needs to be corrected immediately. On the other end, alkalosis tends not to be as critical or as dangerous, but it is something that still needs to be corrected. In terms of respiratory alkalosis, it's usually because of hyperventilation. When you breathe, you're breathing out a lot of CO2. So that CO2 tends to drop. Remember, the arrows are facing different directions. We know alkaline, the arrow is up, and they're breathing out all of that CO2 really quickly because they're hyperventilating. On the other end, metabolic acidosis, there's probably the prime culprit is diabetic ketoacidosis. These patients tend to come in with a very, very low pH, usually below 7, sometimes can be a little bit above, a little bit below, but especially the ones that are below 7 are in some danger. They tend to have a very, very low bicarb. So one of the treatments for DKA, you're giving a whole bunch of bicarb. This is an emergency. And finally, metabolic alkalosis, usually from the loss of electrolytes, someone who has had a lot of nausea, vomiting, a lot of diarrhea, and like I said, it's not as critical, but it does still need to be corrected, usually by replacing some of those electrolytes. So that's it for this presentation. If you like this, you can please just subscribe, like the video, and I'd like to make some more. And I hope you learned something today and you go on to do great things in nursing school and on your NCLEX. Thank you.